Hello, Heartbeaters, and welcome to episode 9 of the Heartbeat podcast. I'm your host, Yokany, Oliveira, and with this episode, we'll be discussing COVID-19 and pulmonology. Pulmonology is the study of the respiratory system, so we'll be speaking to a lung specialist. Stay tuned for more. We are joined today by Dr. Willie Bruwer. Am I pronouncing it correctly, Doctor?
Yes.
Thank you for joining us today. Dr. Bruwer was recently diagnosed with COVID-19, but what's interesting in his case is that he is a lung specialist or pulmonologist by profession. So, Doctor, can you basically just run us down through how many years have you been practicing as a doctor in this specialty, and what you do?
Yeah. Sure. I qualified as a specialist physician in 2012, and then did pulmonology training for another 2 years. So I qualified as a pulmonologist at the end of 2014, and then I came back to Namibia. I'm a Namibian, born here, but I did all my training in South Africa. So I've been practicing in Namibia since end of 2014.
Yeah. And so taking us through your COVID journey as an individual, how and when did you contract COVID-19? How did that happen?
Yeah. So I was tested on the 11th of August. The reason why I tested was that some of my colleagues actually tested positive. They went for the test I heard their result. They tested positive on the Monday. I heard the results on the Tuesday, and then at that stage, I just thought it's better to do the test. So we then tested the Tuesday morning, and I got the results late afternoon positive. At that stage, I was totally asymptomatic, so it was quite a shock. I didn't expect it.
Yeah.
But yeah.
Yeah. And did you develop any symptoms thereafter, or were you completely fine?
Yeah. So in retrospect, actually the Sunday before I had quite severe headaches, which it seems is actually a common occurrence in COVID. Yeah. At the time, I didn't make much of it. I thought it's just a normal headache. I took a few paracetamols and it went away. And then on the Thursday following my test, I started having symptoms. Yeah. I was fortunate in that the symptoms weren't that severe. I basically had a tight chest, shortness of breath with minimal activity. I mean, getting out of bed, walking a few steps, I became tired. Yeah. And I had a very low-grade fever. That lasted, and I lost my smell, which is actually also quite common in COVID patients. Yeah. What I didn't lose is I didn't lose my taste, which was quite an interesting experience. Yeah. But anyway, so I had symptoms then, the shortness of breath, basically from the Thursday till the Saturday. And by the Sunday, I started feeling better again. And pretty much by the Monday, I was totally asymptomatic again. So I was very fortunate. I mean, many patients have much worse symptoms, severe joint pains, muscle pains, fevers, those type of things, and even worse shortness of breath than I had. But yeah, for a few days I had symptoms, and since then, fortunately, I've recovered.
Yeah. And so you did not experience the pressure on your chest or your lungs at some.
Yeah, well, yes, with the shortness of breath and the tight chested. So I basically on this Thursday, I mean, then I felt sort of unwell. I mean, in retrospect, it probably wasn't that bad, but I mean, you had the tight chest and you felt like you can't breathe properly. And I did my saturations. I actually regularly monitored my saturation from the time I was diagnosed, and pulse rate. And on that Thursday, the saturation started going down on the finger saturation, and then my pulse rate also, my resting pulse rate went up. Mm-hmm. So you could feel you're not well.
Yeah. And so how have you so you've recovered now? It's safe to say that you've recovered.
Yes. Yeah. So I've so that was on the 11th. On the 20th, my first test was on the 11th. On the 21st, as per government protocol, I went for a follow-up test, and I tested negative, which is a surprise because most people don't test negative on day 10. But and because I was at that stage sort of 3 days symptom free, that was a Friday. The following Monday, I was cleared to come back to work, and at this stage, I'm fully recovered.
Yeah. And so how did you manage COVID? I don't know if you have a family at home and how you were coping with it. Did you isolate yourself in a certain room, and how did you treat yourself?
Yeah, yes. So from when I got home on the Tuesday, even before I had the test results, I self-isolated. So essentially, again, as per the standard operating procedures, you have to have a bedroom and a bathroom which nobody else uses, and that's essentially what I did. So I basically locked myself into our bedroom with a ensuite bathroom, and that's where I stayed for the 10 days. I must say it's quite an emotionally draining thing to be by yourself the whole time, and it does get frustrating at times. But I decided, because of my kids, and I knew they had contact with me beforehand, so there was obviously a possibility that they could be infected, but I didn't want to re-expose them, and if they weren't infected before, then I tried to prevent infection with them.
And talking about just taking care of yourself in general, did you have any home, remedies to make yourself feel better?
Yes, I've even before I had the COVID, I started taking vitamin C supplements and vitamin D supplements, as well as zinc supplements. During the time that I was sick, I also took some anticoagulants, which there's not a lot of evidence for, but given that I had some risk factors, I decided it's probably safer for me to do it. In retrospect, I don't know if I would do it again, given the sort of minimal symptoms that I had. But those were the things that I took, and then obviously I had a home saturation monitor that I frequently check my saturations with, to see at least how the blood oxygen levels are.
Right. And so from a pulmonologist perspective, so medically speaking, can you talk about how COVID-19 impacts the lungs? I don't know. Yeah, can you maybe just explain that to us, please?
So basically and it's important to realize that COVID has a spectrum of disease. So not everybody will get lung infection per se. It is, but the patients who do develop lung infection, so most often it's an upper respiratory tract infection, so sore throat, blocked nose, as I mentioned, loss of smell, loss of taste. But in some cases, it does cause inflammation in the lungs or a pneumonic process. And essentially then what happens is you get the lungs' ability to transfer oxygen from the air to the blood vessels gets impaired, be it due to either fluid collecting in the small air spaces of the lung, or then even in some cases clotting of the small blood vessels that should actually collect the oxygen in the blood from the lungs. So it's actually two things. It's one part the inflammation, and then the second part the small blood clots that can develop in the lungs.
Yeah, and so we obviously, people experience COVID-19 differently. That's a given. Obviously you didn't go through the severe the lung pressure or whatever you call that.
Yes.
But obviously from the less severe cases, maybe people would want to know, how do I say control my breathing, or how do I better my breathing? Instance that I can't.
I think that it is actually quite important to focus on that. What I find in the practice is we often the patients who get bad complications, well, not all of them, but we often find that patients really present late. With COVID we see it because we know that the disease has sort of a slow onset and then rapidly deteriorates. Okay, so over a few hours, you can actually become quite severely sick. What we found is if patients can look at, for instance, their blood pressure, their pulse rate, and their breathing rate, and if they start realizing, listen, I was able to walk easily, say 10 steps, and now I'm breathing faster when I do that, or a short distance. That's the time where one should really get to a healthcare worker so that you can be assessed, because that might be the initial sort of onset of this rapid deterioration. When we don't want to wait till it's too late, because then we're really struggling with sort of trying to catch up what we could have possibly even prevented if we saw the patient early enough.
Yeah. And speaking from your experience as a health professional, how are health professionals like yourself coping with patients that come in and out who have tested positive for COVID? How has it been so far? Obviously, it's a bit traumatic because our health system isn't really used to this new thing, you know? So how's it going?
I must say, it is quite a challenge. I actually told my wife the other day, it's the first time since I've practiced, and I mean, even qualifying as a general practitioner in 2003, I've never worked in a hospital where I've seen so many patients with the same diagnosis. I mean, I know in the public and in the social media, lots of people make comments that this is just a flu. Now, I've never ever seen a flu where I've admitted, say, 10 patients on the same day with the same diagnosis. It just doesn't work like that. And what this does is it really puts strain on the health services, because we're really at the beginning of the local epidemic of this international pandemic. But and we can already see that the hospital beds are starting to fill up. I mean, we have to move patients frequently from one hospital to, if we need admission, then suddenly we have to transfer to a different hospital, and that is going to be a problem. From a staffing perspective, I think the nursing staff and even the doctors are obviously scared of the disease. It puts a massive emotional strain on them, which one would also have to try and manage. I'm fortunate that I'm now over the disease, and one presumes I would have some form of immunity. So for me, it's a bit easier to work with the patients than it was definitely before I got sick. I'm less scared of the disease, if one wants to call it that. But the healthcare system is definitely under strain at this stage, and we should try our best to mitigate the effects that this disease has on the healthcare system.
Right. And so you mentioned immunity. It's obviously a reinfection is possible. We know this. But maybe from a medical perspective, you know, how does infection affect a weaker lung than it would somebody who isn't so much at risk, you know, like in general?
Yeah, okay, so there's a few parts to this the question. So the first question is with regards to risk factors. Now, I think that there are certain risk factors that makes you at higher risk, and one would have to monitor those type of patients closer than one would have possibly persons with lower risk factors. Higher risk factors include things like diabetes, chronic lung diseases, for instance, emphysema, or previous structural lung diseases, people who had previous tuberculosis, for instance, with lung destruction, those type of diseases. Then we get patients with chronic heart disease being at risk, cancers being a risk factor, and then also patients who's overweight. We are actually we've recently learned that your body weight is actually becoming more and more prominent risk factor than we initially thought. Initially, the CDC had a classification where they put patients with a body mass index of above 40 at risk, and now they brought that down, that anybody with a body mass index of 30 or more is actually at higher risk. So yes, definitely risk factors plays a role. The second part of the question with regards to immunity, we are fortunate that it seems, initially we weren't sure, but at the moment it seems that most people that gets infected with the virus do develop an immune response, and make it less likely to, at least in the first few months, to be reinfected. We are still not sure what will happen if the virus actually mutates, like we see with a yearly influenza virus, that you can get this influenza on a yearly basis, basically. But in coronaviruses, it seems, if we look at the literature that's starting to come out now, that's not likely to be as big a problem as it is with the influenza virus.
Yeah.
So hopefully we will have some form of longer term immunity once you've been infected, even if you had mild disease.
Yeah, and I don't know if you've been keeping up to par with the progress of a vaccine or whatever, but if a vaccine is developed, how do you think it would reach us here in Africa or Namibia? I mean,
I think we're fortunate in that most of the sort of international community realizes this is a humanitarian crisis that we're sitting in. So even with, for instance, this new drug that is now available called remdesivir, which was initially developed for Ebola, and then they realized, listen, this could work for coronavirus. I mean, it's probably been approved in the United States, maybe say 4 months ago, by a company that produces it in United States. And we are fortunate that they then, instead of holding on to the patent, gave it to some of the generic companies to make similar drugs or generic drugs to this for instance, Namibia, and we were able to get that. And I think the same will probably happen when we get to a vaccine. I'm very hopeful that we will get to a vaccine. It seems very likely. There's a few good candidates currently in phase 3 trials, which seem to be going well. And there's actually a few of the companies who started producing vaccines already in anticipation of them actually having an effective vaccine going through the phase 3 trials. So if everything goes well, we might, if we're very lucky, before the end of the year, but most probably early next year, sit with an effective vaccine.
Yeah. Okay, doctor. That's all the questions I have for you. Thank you so much for your expertise and your help. We're glad that you are up and running again. You look so good. You look healthy. So we're glad.
Thank you very much. Yeah, no, I'm glad to be back.
Yeah. Is there anything you want to add, end off with? Anything like to say to the public?
Yeah, I think the important thing is that we now in the midst of it, and we should really try and just manage the epidemic at this stage. So each person should really try and protect themselves. Do the social distancing, wash your hands very frequently, wear the masks when you're in public, avoid as much as possible contact with people outside of your family nucleus where you spend time with anyway, to just try and mitigate the effect. I mean, we know it's essentially, if we look at the rest of the world, we get a peak and it's I mean, within say a month or two, we will be over the worst of it, and it's just for this first few weeks, say 6 weeks or whatever we've got left before we will see a downward trend, and we must just hang in there and try and stick to the rules.
And that brings an end to this week's Heartbeat podcast. But what did you think about this topic? Leave your thoughts in the comment section below, or give us a shout out on social media using the hashtag Heartbeat. You're welcome to drop me an email. It's yokany@namibian.com.na. And remember, please wash your hands, social distance, and wear your mask. From me, your host Yokany, it's goodbye.